Hello everyone. I hope you all are doing really well. So we all know that International Stuttering Awareness Day is coming up on 22nd of October. And we have all been reading, learning more and more about stuttering these days. Even we have been posting about a few things recently. So today we have with us a clinical psychologist, Drishti Rambhia, with us. And this session is specifically to highlight the role of psychologists in stuttering patients. We all know and we have read it, and it's well evidenced that having a psychologist as a team member in stuttering cases will have better results, quicker results, and also it will reduce the chances of your relapse. So today we are going to have a short talk with Mrs. Drishti Rambhia. She has done her BA in psychology from Jai Hind College and an MA from Manivel Nanavati SNDT University. Her certifications include intensive clinical training in psychotherapy from D'Souza Foundation and intensive training course in counseling from Heart to Heart Foundation. Her work experience include working with both children and adults and also in the rehabilitation of children with special needs. She has worked in various speech therapy private clinics where she has worked with stuttering cases. And we are very happy to have you here with us today so that you can share your knowledge with us. Thank you, Drishti, for being with us today.
Thank you very much. Let's get started.
Yes.
Yeah. Okay. So just to begin with, can you first, like it's a very basic question to just understand what exactly is the role of a psychologist in stuttering? And how do psychology sessions go about?
Okay. So, a basic psychology session for speech related disorders would go about in the sense you would start with building rapport with the patient, whether it's a child or an adult. You would try to understand if there is any, anxiety related to the disfluency or the stuttering, and any other management that you can help the client or the patient to do better in terms of finding results for stuttering of fluency.
So basically, your main role is to work around with the anxiety related part, with the entire cognitive part in stuttering cases, in fluency disorder. That's right.
Yes.
It's like, can you elaborate a little more?
Yes. So cognition, which could affect behavior, and behavior in the sense that in certain, like, for to make it easy, I'll give an example. Now, in a lot of cases, we do know that patients who have stuttering either have anxiety related to this because of the stuttering, they have an anticipated anxiety, or sometimes it happens that when they are in high stress situations, or when they are in certain moods, that is when the stuttering automatically kind of gets a little bit more severe. So in such cases, we try to understand how best to manage the environment for the client, as well as what they can do when they are in such situations. And these cognitions that they have sometimes kind of affect their behavior. So to understand and break certain kind of thinking patterns that the patient has, and then to help them thus overcome certain anxiety.
Right. Okay. So how do we decide if if a patient requires a psychological assessment and following sessions? Because all the patients may not require. So when is it the time that we should refer a case to a you?
Yeah, I
Okay.
mean, because if it's a severe case, I think we'll send it to a psychologist like by default. But what about cases which are not very severe but might require, psychological intervention as well? How do we assess and decide that?
Right. So ideally, it would be helpful if every case of stuttering or stammering at least meets with a psychologist for one session. What happens is in more severe cases, it's very easy to say that, okay, there might be certain comorbidities. So you can have formal assessment done to understand what comorbidities lie, and then to have a wholesome kind of outlook and therapy plan for the patient, where we can work on certain psychological therapy. We can do therapy to just work on the psyche. However, in cases moderate or still milder cases, what happens is we tend to our outlook becomes, okay, I have this problem and I can more or less deal with it. But in such cases, stress management, or cases like what they can actually just do to kind of better their environment, to kind of get an idea of their strengths and weaknesses, and then to benefit from that. So even if you meet with a psychologist once, letting, like, it's always a teamwork. So when you have a psychologist on board, you should at least have one session with them for adult patients. For children as well, something similar happens. Sometimes you can have a session with the parents to understand what the child needs to do or what they don't need to do. So you kind of get the right wholesome view in terms of therapy.
Right. I think this is a very important point. Like having at least one session with a psychologist should literally be by default, right? And like, because I remember working with patients while, like, while I was studying, and we honestly did not have any contact with the psychologist whatsoever. It's just they come in, it could be severe, it could be mild. So I think that this is a very important point.
Correct. Yes. Okay, we can have the next question.
Yeah, so talking about anxiety, the stress management, can you just enlist like what kind of techniques are used? I think the majority of us have heard about CBT, the cognitive behavior therapy, but we don't know how exactly does that happen, and what are the other techniques that are used in your sessions.
So there are sessions, yes, of course, CBT, cognitive behavior therapy, is quite widely used. Apart from that, so for kids specifically, there is play therapy or modeling or mirroring as techniques that, are very, very helpful. Apart from that, there is modeling that you can use with adults. We have CBT, we have cognitive therapies just as it is. We also teach our patients coping mechanisms that they can better deal with their stress with. So I'll give you information about what CBT is basically. So the crux of CBT is to challenge unhelpful negative thought patterns you have, that will help in enhancing your emotional regulation, and thus the behavior the behavior that is related to your speech or related to anxiety and stress management, how to correct that kind of behavior. So essentially, when patients come in, we try to challenge the thoughts that are not helpful or that are automatically negative, and kind of try to re-regulate those thoughts.
Okay. Now that's interesting actually. And how can we as speech therapists incorporate this in our sessions? Because most likely, like, our sessions have, we have a very fixed pattern, especially when it comes to this domain, like, breathing or whatever techniques we've picked for the patient, and the session starts off like that with a little bit of counseling as and when required. So how can we incorporate these in our sessions to have a better you know output? Because cognitive training, I think,
We are not
formulates like
trained for
50%.
most of it. Yeah.
So what happens is, I mean, you must have noticed that many times your patients have come in, you have a fixed, schedule, and you know exactly what to do because the patients have been doing well so far. And suddenly you have a session and you're just bombed because, the patient isn't in mood, or they've come in really high, like they've had probably like an anxiety filled situation. It could be like a presentation or an exam. And suddenly, the progress has, like, there is a lot of regression that you see suddenly. And we try to do is we try to kind of maintain it. We don't know what happened. So in such situations, my recommendation would be in general to, kind of use methods of distraction or imaging, where you kind of ask your client to ideate their most idealistic situation, their happy memories, before you even start with any of your techniques for relaxation. Because I mean, anybody telling you to relax when you're really not will not really. So kind of, trying to put them in a better frame of mind before you even start with your relaxation techniques is something that will really help. You can try that next time. For kids also, kids, who are usually like they come in during and they have to sit for an hour. So initially there might also be sessions where they really don't want to sit in one place. So for them as well, to begin with, some kind of game that they like. A negotiation works very well with kids. So when you kind of have them leading the session, that also works. So before they're even ready to settle down, maybe like jumping around with them or doing an activity, playing a little song that they like would work.
Right.
Okay.
So our next question was that only you partly answered it. Like, how is a psychologist session different for a child? And since a child will not be able to understand what we exactly expect from them. So, like you said, that if it's child centered, it would be better to start off with that. But even if it is child centered, like even if we start like that, can you tell us more about what further? Because they will not be able to incorporate any of your techniques, or they don't know when they have anxiety. They can't tap those things. So what do you do in those cases?
So many times we notice that a session with a child, unlike that with adults, is usually driven by children. We don't, no matter how hard we have like a fixed schedule, we never end up following it with children because they always have needs. So with children, it is best to let them drive the entire session. It is best to let them, tell you what they are up for today. That it is very important to keep in mind their kind of ideas, imaginations, their interests, what they like. They tend to pick up certain colors or certain things that they really like, and to kind of learn negotiating with them. Reward systems work really well. Initially, like whenever you're building rapport with a child, whether it is for speech related or otherwise, it is so important to keep in mind that the child works best with reward systems. You give it, you give them something that they like in return for something that you're asking them to do. Children also learn in this manner. They also learn how to follow instructions. Usually we start working with kids at a really young age. So for them, they don't even know what it is like to sit and answer questions. It becomes more like a classroom session for them if we don't incorporate these things. It might be that initially you might have to use a lot more rewards. You have to do a reward system for every task that they follow. And soon when they get used to this, you can slow it down. You have to keep changing the kind of rewards so the child doesn't get bored. You can also use games which teach child to listen to a question and then answer. And that could be visual aids where you're asking them a question and you're teaching them how to listen first and then answer what they're being asked. That helps them to follow instructions in the later sessions, and then you can build up, and accordingly then they'll start understanding.
Right.
Yeah, I think this makes complete sense. Do you would you recommend, or or do you do incorporating your psychology related techniques in our sessions? And I'm sure if you all are also working, you all look at the fluency techniques given by the speech therapist. So is it good to have observations of each other's session happening every now and then if your
Yes,
workplace
obviously,
permits?
of course, a wholesome technique when you have a team of psychologists working together. I mean, psychologists with speech therapists working together. Also, occupational therapists play an important role. A child will do best when you have your OT, your speech therapist, and your psychologist kind of working together, having certain of their systems, rewards, be it reward systems or be it certain techniques that they use that work best for the child, instead of having them divided. If you as a team, if you can kind of communicate with each other, or best if you can observe sessions, what's working for a child, what trigger points there are, so you can use the same technique. For me as a psychologist, I will use the technique, but I will try to work on a very different aspect of their behavior. And the same technique used by you then can be used to rectify any of their speech disfluencies, to rectify the techniques that they're using, so that they have a more wholesome outlook approach, which when they go out and step into the real world, they can then apply better.
Okay.
Okay.
Okay. I just had a question, while you were explaining, we've received a lot of questions on this, that if it's a child or an adult, either, and they have a lot of secondary behaviors, would you target secondary behaviors initially? Would you work on them simultaneously, or you keep it, to work on by itself, and you focus more on. One second, is that me? Can you all hear a disturbance?
Yeah, there is a disturbance, but it's fine. Yeah.
Okay. Sorry. What? Yeah. So, would you work on the secondary behavior simultaneously, or you work more on the self-confidence, the improving or enhancing their fluencies, reducing stuttering, and then let the secondary behaviors take care of itself?
So it's like saying, I'm sending my car for repair, but I don't want to really repair the side mirror. You know, you're not really kind of, the whole picture is not really then filled.
Right.
When you work on secondary behaviors, probably, you know, will influence your primary behaviors or your speech related behaviors that would be primary for you. So if you don't really follow the whole cycle, you will notice a stagnancy. You might work really hard on certain speech related technique, which you just cannot, you know, kind of seem to overstep no matter what you like, no matter what you do. So what
Right.
happens is, for example, a child who might be very naughty, as you know, at home. And since we only do 2 or maximum 3 hours a week with each child, we won't know if they are really able to apply what we're doing here back at home. So if the child is naughty, chances are that they kind of are, you know, rebellious. They won't listen to instructions. They won't kind of have any motivation to practice what, you know, you're teaching them back at home. So then it gets really important to kind of motivate the child internally. The child has to be motivated to practice and to, you know, kind of get over that by themselves.
Yeah.
So to work on certain secondary behaviors, it kind of, you know, you might see an overnight change without really actually having to work on certain speech related behavior. So it is a must
Oh,
that you can work together.
Right.
Yeah,
okay.
it works like
How? Yeah, how exactly? Because what I understand, you can work on secondary behaviors maximum by using visual feedback, or maybe if it's something like nasal flaring, then having a tactile and a visual feedback. Are there any other techniques that you all use, like specifically to target secondary behaviors?
Could you give me an example? Maybe I can explain that better then.
So like one of the cases I've handled, it's a child, and when the child is maybe it's not a situation, maybe something he knows, and the child is pretty aware. Okay, he gets blocks, he will have a block, so he'll get a head jerk, or he'll start moving his hand, or
Fist
maybe
or
stomp his
stamping.
legs,
Yeah.
something like that. So in this case, how would I go about with the secondary behaviors? Because I feel they are more severe than the actual, fluency stuttering
Right.
blocks,
So it's a mental block.
which makes exact sense. The secondary behaviors affecting the main primary, the
Right.
fluency.
So,
So,
I think more the child obviously knows the techniques, is what I'm understanding. And here, what happens is it's a block, so you don't even know where the block is literally. It's not like the roadblock that you can actually pinpoint, okay, that this is the problem. Here, according to me, it is more important to understand why the child is really feeling that. It might be that the child is assuming a very unnecessarily, extreme reaction to him stuttering. He might, have this feeling that he might be punished severely, or he might have something which is really disturbing for him. He might not be able to explain that to us or express that or even know that for himself. But they might kind of anticipate unnecessary consequences, which lead them to uh, avoid the behavior in general. So for them, it is like I rather see, or I rather do something else which is grabbing more attention, which is why there's a lot of banging, a lot of attention seeking behavior, body language wise, so that that attention from his lack of being able to talk would move from that to something else. They sometimes also tend to realize that children, if they don't want to answer something, they would run away, or they would like kind of do something, throw something, so that the reaction, your the other opposite person's attention is completely off the fact that he is not able to talk. So it's kind of
right.
really important at this point to probably stop the child from even realizing that that is an issue, maybe encouraging the child to just focus on something entirely different. Here you could try techniques like completely distracting the child, maybe making them play something. In that manner, what they would think is that they have gotten away with it, they don't need to do what they had to do. And then suddenly you will notice that when you've tried the same thing after 5 minutes, once you've given them enough to feel comfortable, they'll be able to do it without even like a minute's delay. So kind of distracting
Right.
them with an activity that they like, and then getting back to this particular technique that you're trying to get them to teach or whatever, that would then eventually just happen on its own.
Correct. So that is like you
Oh,
treat your like underlying cause is the base is different. So you directly target those base instead of just to going on to speak like this, speak
yeah,
like that. But
because yeah, correct.
Yes, because
Because the general notion is like, work on the fluency, work on the blocks that are coming. And I mean, that is what even I used to think, like, let the secondary behaviors get resolved on their own once the child builds more self confidence. But yeah, that is one reason. There could be other reasons of, as you mentioned, the secondary behavior. So, yes, makes complete sense to me.
right.
And
So last question for you, Drishti. What do you feel about counseling of parents? Like we as therapists in our sessions, when it's a child case, we definitely counsel parents. We tell them this is to be done, this is not to be done. But that is like more of us telling them that what you should be doing and what you shouldn't be doing. Which I have seen personally that when a psychologist is there with us on the team and after counseling from you, the scene completely changes. Maybe they start incorporating. So, what is that exact point that, like, how do you deal with counseling the parents, psychoeducating the parents?
so it's extremely important to understand that probably the anxiety is more within parents, and actually it's more lack of awareness, because parents really come in and they're like, my child isn't talking and we don't know what to do about this. They might not even know exact terms or exactly what's going on with the child. So initially, if you notice, when the parents do come in and you've had a formal assessment done for the child, we've given them information about what the assessment is and what the plan of action should be. The parent has a lot of venting to do, because obviously it is some kind of build up in terms of why they've really even stepped into the clinic. There's a lot of anxiety around why my child is not acting according to the rest of his peers. And there's a lot of comparison. That's usually when parents step in, that he's already to everybody and his friend circle is talking and he isn't, and I don't know what to do. So there is a lot of anxiety. There's a lot of comparison that they've already been doing with the kids of their friends or the child's peers, and there is a lack of awareness as to what they can do. They feel really, helpless. So when a professional steps in, psychoeducation is generally important for the parents, because as soon as they step in and they know, okay, something is up, and what I want to do, the professional can listen to them, understand what's really happening, help them to understand what plan of action is being done and why it's being done. What certain things that the parent is doing back at home could have caused certain behaviors to, kind of come up a little more, and what they can do to change or help them. At the same time, parents do need a little bit of support in terms of even for them to feel like, okay, whatever is happening with the child, they kind of get affected by that as well. So kind of giving them a listening ear initially would help us understand the causes of a lot of problems. And thus, when you explain to the parent exactly what technique will be used and why, why that will be used for your child and how that will help, kind of makes them really at ease and comfort, and that helps them understand exactly what's going on. So then, because see, parents spend most of the time with their child. We are going to spend 2 hours, 3, maximum 4 a week. And everything else, all of the techniques, whether, they are related to just speech or in terms of behavior, are only going to be practiced at home. And things need to change back at home as well. So kind of put
but
the
it's but
parents
it's
on
so
board.
difficult, don't you think? Because it's like, I mean, especially considering the scenario we have here in Mumbai, it's a super fast life. Both parents are working, they have tons of things to do. It's not about practicing with the child, it's about the way they talk to their own child. Like, you need to do this, chalo, get ready for school, finish your homework, done. It's like it's so fast and a child is unable to cope because the child needs time and there is no time. And it's like parents are helpless, like I can't stop my routine. It's like, how do you balance these both situations? It's super difficult.
Yes. So sometimes, when the parent comes and they have exactly these problems, they're like, what, I am doing everything I can for the child, and I've come
Yeah,
in and child isn't talking to me and I don't know what to do. And all they realize is that spending half an hour a day, removing that half an hour of time and not even really addressing the problem, just playing with the child. And within a month, a parent has come in and said, oh my God, things have completely turned around. And it's
yeah,
something as of that. So when we talk to parents, what we realize is there are certain problems not within the child's routine, but the parents' routine that you can change. And it takes like 2 minutes of your time to realize that. And parents, when they apply it, they find it really easy. So sometimes the parents' anxiety can kind of push over to a child, which may, kind of enhance any kind of issue that you could face.
Right.
Great. Yeah. Okay, I just had one question. It again just came up to me while you were talking, you were explaining about situations like you mentioned, for again, both child or adult, like situations, as you said, which induce anxiety, presenting or going to a party, having to interact with so many people. It's like a pressure situation for them. How can we, like, are there any certain tips, certain points that we can, help the patient with from our end as well? Like maybe, how can they reduce the pressure and thus get better fluency as well?
So, surprise is the key word here. Many times when patients, I mean, I remember this one thing. I had a patient who was brilliant with, he had really mastered all of his techniques. And suddenly one day he came up to me and he's like, I don't know what to do. I have a presentation tomorrow, which I'm completely unprepared for. And all we asked him to do was sing some songs in front of the mirror. And, that kind of works. Sometimes patients tend to lose sight of something that's really easy, that, kind of a technique that they can use, which is really easy right in front of them. But, I mean, it's mostly you just have to learn to relax. And sometimes, techniques don't
Yeah.
help. You just do something that you really like to do. So in cases where you have presentations or you have exams, those are really high stress producing events. One is it's really important to manage stress. So, you have to time manage, you have to learn to prepare well in advance. But when sometimes, in spite of all of those things, you just don't know, because sometimes it will be a completely new environment, a new situation, or a new office where you have to do this. Kind of keeping, something that you find really easy to do can invoke that sense of achievement. So when you realize that, oh, I'm not able to talk what I have to in terms of technical terms, but you know that you a song in rhythm, and when you start singing that song, you realize talking is actually not as difficult as you're making it to be. And so sometimes that helps. And then you find it easier to explain. Also, addressing the elephant in the room. Many times you make such a big deal of it. So when you realize that, when you try to introduce yourself to people, getting comfortable in the environment also works. So in case there is a patient who comes to you and tells you that, okay, I have a presentation tomorrow and I don't know what to do, you can tell them that, why not take 5 minutes before the presentation just to meet certain people in the room, to kind of befriend them, to let them know what your name is, so you don't feel as uncomfortable when you're actually in the on the center stage.
Correct.
Okay,
Right.
yes, makes sense. And this is good for like patients. I mean, doesn't matter their age. For adults itself, but the cognition differs. An adult, same age, 25, 25, but one would be cognitively much better or much capable at handling stress or understanding what you want him to do. The other might not. So does that still work? Like maybe you just change the achievement differing, based on their personalities. Does it work like that?
When you have a person who's cognitively more stuck, or who has more such negative thought patterns, which you kind of then start working on them situation basis. So it would take a little bit longer for that person to kind of the tasks would have to be much simpler for them to feel a sense of achievement. You have to realize, when you're kind
Yeah.
of challenging certain thoughts, for them to understand the power of changing that pattern, they need to learn to they need to kind of um, actually achieve certain things. So in the sense that there is somebody who's much better to handle stress, you would probably put him in a higher pressure stress situation, and he might still do better. But for
Right.
someone who, at a much lower cognitive level, where they are not able to handle that kind of stress, where they face a lot of anxiety, to put them in a high stress situation could sometimes backfire because they might
Yeah.
not achieve a certain thing. And
Hmm.
all of then you notice that their lack of their sense of achievement is somewhere really questioned. Um,
Yeah, I think this is one important, like, thing that we as therapists need to understand. Like, kind of, if we say, we're going to put them in stress situations to get them practice their techniques better, but choosing the kind of situation you are, understanding your patient's level, and then choosing makes more sense. You can't just randomly have a very set, presentation wala
Criteria,
or
yeah.
interacting with 10 people in the clinic, something. You can't have that for everybody at any point, like just randomly.
Yeah.
it is very important to keep in mind what rapport you have with your patient, and then to decide the kind of stress you would want to put them in. Because many times when you don't have that kind of rapport, a patient may get offended and may completely shut down to therapy. So, especially in the few stages, it is so important to understand what kind of rapport you have with the patient, how the patient is responding to you. Sometimes sarcasm doesn't work with a lot of people, and it works with a lot of others. So, if patient might get offended and might completely shut down the therapy, not just with you in general, because they wouldn't wouldn't like to be challenged a certain way. So initial stages, it is really important to understand where you're at in terms of rapport with the patient before you decide to put them in any kind of pressure test.
Yes.
Yes.
Yeah.
I think we are good. I mean, we are done with our questions, and you really gave us a good insight about, like, we were always wondering. And of course, like, Risha has worked with you and she knows it better. And but most of us are really blank, as in we always read in books that we should have a psychologist with us for stuttering cases, for many cases actually, but one of the most important is stuttering. So you really gave a good insight about how exactly things work. And thank you so much for that, your time and your knowledge. Thank you very
Yes,
much.
it was always free feel to get in touch. We can do this again, hopefully, any other topic also.
Yeah, definitely.
Definitely.
Okay.
Great.
Yeah. Thank
Thank
you.
you.